All right, so I got a story here for you guys that kind of blows up the entire narrative that we are often sold about the nature of the free labor market under a capitalist system, because workers at a Wisconsin hospital, as you can see here from Business Insider, were trying to find new jobs that would have given them better pay and better benefits, and then the hospital that they were working for, a for-profit corporation, sued to stop them from leaving, and as of right now have been successful in preventing these people who were just trying to go look for better jobs with better pay and better benefits. Okay, so this story is absolutely wild from an objective standpoint, but at the same time, it's also not surprising when you understand the nature of the U.S. justice system and also just the nature of the U.S. government, and that they pretty much always, without ever breaking from this trend, side with corporations over people. Okay, so let's just go ahead and get into some of the details here, because this shit is absolutely wild. They say a Wisconsin court has granted a hospital's request to block 7 healthcare workers from leaving to start new jobs at a competitor. And they say ThedaCare, a hospital in Appleton, Wisconsin, asked the court for a temporary restraining order to prevent the employees from accepting jobs at Ascension Northeast, Wisconsin, a competitor hospital. And they say Mark J. McGinnis, a judge for the, and I'm definitely going to butcher this name, Outagamie County Circuit Court, granted ThedaCare the temporary restraining order on January 20th, and attorneys representing both hospitals agreed to meet the morning of January 24th to see if they could come to another resolution. So obviously today is January 24th, so we're still waiting to see exactly how this is played out. But even the fact that this judge was willing to grant them a temporary restraining order from these hospital workers who are at will employed people who don't have a contractual obligation to work for ThedaCare. The fact that the judge is even filing a restraining order on behalf of them to prevent them from going and taking these jobs just completely flies in the face of everything that we are always told about how a free labor market is supposed to work, right? Because under a capitalist system, this is what they tell us, is that you should be able as a worker to go, find a new job immediately when you want to, and that's basically your leverage that you have at your disposal. Is the employer knows that you can leave at any time and go find a better job that's offering better pay or better benefits or whatever the details may be, and that threat that the employer knows to exist is basically a motivation for them to pay you more to try to keep you as one of their employees. But obviously, if a judge is going to step in this entire process and is going to literally by restraining order prevent you from going and taking that new position, then you can't even potentially reasonably call this a free labor market. It's just wage slavery, essentially. I mean, depending on how you want to go about talking about it, but wage slavery is something that is, baked into the capitalist system. It exists for every single worker under this system. So it's not just these hospital workers, but it applies to the general economic structure that we have going on here. But they continue with some of the details, saying the granted order states that Ascension, the other competitor hospital here, must either give back ThedaCare a radiology technician and a registered nurse out of the 7 workers resigning, or cease the hiring of all 7 workers until ThedaCare has hired replacements. So basically, the argument that ThedaCare is trying to make to keep these workers employed under them is that, because of COVID, we have these massive surges and we can't afford to lose these essential workers, these essential personnel, or, that could have disastrous consequences for the community or for patients who are showing up and need these doctors to be there, basically. But the argument to push back against that is pretty evident when you actually get into the details and realize that they had weeks to give a counter offer to what these workers were asking for, okay? So the workers were going out, they looked at Ascension, this other competitor hospital, and they said, they're offering better pay, they're offering better benefits, I'm going to go work there. But before they did that, they went back to ThedaCare, okay, the hospital that they are currently working at, and they gave them that offer and said, you can match this, okay? You can give us better pay, you can give us better benefits, and we'll stay here. And ThedaCare refused to do that, okay? So they didn't even give them a counter offer that was competitive with the other company, and yet the judge is still siding with their argument that, what can we do? It's COVID and we have this surge and our hospital's overrun and we simply need these people. It's like, if you needed them, then you should have offered them better pay and better benefits that they were getting from this other company that they were trying to leave to go to. Okay, so again, it's just completely ridiculous at face value. But here you have a state representative, an actual judge, who is siding with a corporation to completely eviscerate any semblance of a free labor market that otherwise would exist under a capitalist system, or what they tell us would exist under a capitalist system. But this is all just part of sort of a dual track, broader picture here, right? This is part of COVID and the ongoing traumatic experience that nurses have been put throughout the entirety of this pandemic, but it's also just a labor rights issue. And so, this is something we have been seeing consistently. This is an article from January 6, 2022 from, again, Business Insider. They say, COVID positive nurses say that they're being pressured to work while sick and they're petrified of infecting patients. Okay, so again, this just ties into this broader issue of what nurses have been put through throughout this entire pandemic, and especially over the Omicron surge, right? Is we have Joe Biden and government representatives going out there and saying this is a mild case. Okay, the Omicron variant, it's a mild variant, right? Okay, it might be mild for an individual person who is fully vaccinated, especially if you get your booster. Yeah, more than likely, it's going to be really, really mild experience for you. Okay, it's very unlikely that you would even end up in the hospital at all if you're fully vaccinated and you're boosted on top of that. In that sense, Omicron is mild, but it's not mild in the sense that we've been averaging like 2,500 deaths per day, okay, for weeks in this country, okay? And that has obvious disastrous consequences just purely from a humanitarian angle if you give a shit about tens of thousands of people dying from a largely preventable disease, or it also has effects obviously on healthcare workers, as our healthcare system across the entirety of the country has been put to the brink of collapse, if not already completely collapsing, and all of that is put on the shoulders of nurses who are just trying to fucking do their job, okay? They're just trying to take care of people, and they're having to deal with an influx of largely unvaccinated COVID patients who are coming in and dying on a daily basis in levels that we haven't seen since, the previous Delta surge, all right? And this is with a substantial portion of our population already vaccinated. So that's a failure of leadership from the federal level to keep calling this a mild variant and shit, while the nurses that are having to deal with this on the front lines are being, that's entirely being put on their shoulders. It's just completely fucked up and completely unfair if you ask me, okay? That's why I'm more in favor of some people would call it more restrictive measures to actually tackle, containing the spread of the viruses. It's like, yeah, it might be a mild experience for you, but it's not a mild experience from the societal level, or especially from the perspective of nurses who have been put through this shit. But again, this is just one aspect of this, okay? They recently were told you have to come into work while COVID positive. And it's not just, corporations pressuring them to do that. It was literally the fucking CDC coming out and saying this, okay? New CDC guidance allows COVID positive healthcare workers to return to work sooner. And it's not as if this is based on the science really at all. They're literally saying, last month the CDC issued that new guidance saying COVID positive healthcare workers can return to work after 5 days or without a negative test if they're asymptomatic or having mild improving symptoms. So again, just super vague, super, out there in terms of what does this actually mean in terms of the science? And you can check in with the with the Oregon Nurses Association, who was saying it's an extraordinary gamble with nurses' health, with the staff health, and with the patient's health. So basically what this is saying is that the CDC, a government agency similar to this judge, are choosing to side with corporate profits and are choosing to side with keeping our economy full blast open to the fullest capacity possible at the expense of our healthcare system, okay? They are literally willing to force nurses to go back to work sick, okay, instead of taking any other public health measures to actually contain the spread of Omicron, okay? Just a complete failure from the top down. But again, just another perspective on this from September 29th, 2021. Again, from Business Insider, they say, claims of anti-vax nurses fueling hospital staff shortages ignore the limited support and lack of mental health care for COVID's frontline workers. So this is one of the main arguments that we were hearing from conservatives throughout this nursing shortage that we had recently, is they were coming out here and they were saying, oh, this is because the vaccine mandate. No, it largely was not, okay? It was due to shitty pay, shitty conditions, and the fact that they've been having to go through literally years of this entire pandemic where they're facing the worst of this, okay? We can all go about our days and pretend as if COVID is over and pretend as if it doesn't exist anymore, but they're still having to deal with this on the front lines, okay? And again, the main reasons that they put forward here, which is also backed up from this other Morning Consult poll, is they cite poor pay and burn-off as reasons for layoffs and resignations. Okay, so essentially, nurses are being treated like shit, right? Again, 1 in 5 healthcare workers have quit their jobs during the pandemic. Okay, so it's not because they're selfish. It's not because they're going out there and they just don't want to work anymore. They just don't want to keep having to deal with COVID. It's because they're being put in this position. Okay, it's been years and years of a pandemic that the federal government has completely failed at every single level to contain the spread of, to protect our hospital systems, to ramp up the production of equipment, and to ensure that nurses are given fair pay and fair benefits. It's a failure at so many different levels. But at the end of the day, it comes down to what we talk about on this channel all the time, the perverse nature of the profit incentive existing in a market like healthcare. Okay, so at the end of the day, the message remains the same. We need to transition towards a single payer healthcare system that is entirely removing the profit motive from our healthcare system, which would lead to better pay for nurses, and you would have lower turnover, and you could provide better adequate benefits for them. It would also be cheaper from the perspective of patients etc. So we all know the benefits that are associated with either nationalizing fully or having a single payer healthcare system instead of the for-profit one that we have right now. But this is just one of those things that ties into that, okay? Nurses have been getting absolutely shafted through this, and it appears like the US government and the state is going to continue siding with corporations at the expense of both nurses and also just our entire public healthcare system as a whole.